I don't know when that stopped. Perfect. Does this make some sense? Where are we? I gotta take a break here in just a minute. Does this make a little bit of sense of how we get nerves? A nerve is a long string. Some nerves send signals just this way. Some nerves send signals just this way. Some nerves can be bundled like this. So they're getting messages back and forth. Even though the black nerves are only going this way, the blue nerves are only going this way, but the whole nerve itself is responsible for sending signals in both directions. Does that make sense?
Yes.
There's no way I can make this any simpler. This is the absolute simplest way. Now try reading about it in the textbook. It will make a little more sense if you read about it in the textbook, but it goes into much more detail. It makes it much more scientific. What's that?
All the words spraying together, and you don't keep in head. So I'd rather watch a video.
Remember to like and subscribe.
I did. I know you.
Thank you.
Yeah.
Oh, there's going to be an assignment in this class as well, just so you know. I need some homework from you. I mean, you already give me a lot of homework, and I appreciate that, but there's going to be more that I'm going to collect from you. Thank you. I'm going to pause the video now. Resumed. Bottom of this page, a CVA is a cerebrovascular accident, also known as a stroke. Bottom of this page, a CVA is a cerebrovascular accident, also known as a stroke.
Yeah, that's what Wait, where did it go?
Bottom of this page. Yeah, you're too far.
Yeah, I got it. I searched.
Cerebrovascular accident, also known as a stroke. That's a disruption of blood flow to the brain. Most people will say, well, that's from a clot. Not necessarily. It can happen from a bleed also, a hemorrhagic stroke. But in any case, blood that should be going to part of the brain is not. Now, how is that different from a heart attack? Well, the heart attack, blood's not going to part of the heart. So it's kind of the same. So they could really have called this a brain attack. And that would have made sense. But instead it's a stroke. Look on the next page, the reflex arc. The next page. After that, the reflex arc. This just demonstrates how some sort of stimulus, like a sharp tack or touching something hot, will send a signal up a nerve, first to the spinal cord. The spinal cord interprets that as this is bad, it hurts, it's sharp, it's on fire, and it sends a signal immediately down to the muscles to pull that area away. Then the signal continues up the spinal cord to the brain, where the brain says, hey, I just touched something. This is the way the spinal cord thinks. The spinal cord has the ability, limited ability, to think and make a decision. That's why if you're talking to someone and they don't realize the stove's on, they put their hand down. As soon as their finger touches it, they pull their hand away, they jump their body away, and they look at their hand and they look down here. It always happens in that order. And the reason for that is because when it touches that hot stove, the signal goes up that nerve to the spinal cord. The spinal cord says, you better move that hand away. In fact, move the whole side of the body away. Then the signal continues up to the brain where it's interpreted as the finger is on fire, it just touched something hot. What was it? It's over there. Yes.
If someone has autism, their concentration
Diminished? No. Because autism is more about socialization. However, other medical conditions can. Something as unrelated as hypothyroidism. Because you would think that has nothing to do with reflexes, but it actually does.
Right now, I think my husband might have. I think he might be on the spectrum, but besides that, like, you know, most kids will pop their hand and they just won't do stuff. Like, it's like we constantly tapping his hand, like, no, he just don't. And I'm telling him, we'll sting his hand and we know it hurt, and he won't react. He won't cry, he won't ball his face up for nothing.
Does he not have a pain stimulus? How old is he?
He'll be 2 in July.
Has he never felt pain?
That's what I'm saying. Like, he'll even put his finger in my mouth, and I'll bite his finger, and then he'll do it again. I'll bite him harder, and he'll do it again. I'll bite it even harder, and he won't do nothing. He just do it again.
Well, there is a condition where a person can have no pain stimulus, and that's actually really dangerous because they will put their hand on a stove and not realize they just did it. They will step on a nail and just keep walking around. So it's actually pretty dangerous. Okay, I'm going to skip since we just did that. So when we're getting that hammer and we're hitting the person right here, we're testing their reflexes. Because we're actually testing the way that nerve sends a signal to the spinal cord and the spinal cord reacts. No, you're supposed to have that kick.
Like when I know they do it, I'll kick.
Yeah, you're not supposed to know about it though. That's the problem. Yes. No, the test goes up to 12. Let's hear it. That's why I'm trying to move this along. Because we have like an hour. Not even now. Much less. So make sure you read through all these other notes of chapter 11 as well as the chapter itself in the book. But make sure you read through these notes. Important.
The next one is long as this one?
Chapter 12?
No, like the next.
I don't know. I can't think off the top of my head which one's coming next. I'll have to check.
And the next one.
Okay. Find chapter 12 in your textbook, please. Find chapter 12 in your textbook, please. All right, let's start with the brain. Go there first. Look on page 253. Two 53 shows a nice sort of side image of the brain. And you can see that it is colored very nicely there. But what you're looking at is one hemisphere of the brain. You're looking at one side of it. So they've taken the brain, which would normally look like this, and they sliced it in half so you're seeing this. Now it is missing the diencephalon and the brainstem and the cerebellum, but that's the rest of it. So you're seeing it from the side view like this. So looking at the brain, the most obvious portion of the brain is what's called the cerebrum. That's this part. It makes up most of the brain. So on page 3, you'll notice it's like the light brown part. All of that is cerebrum. And you'll notice it has a bunch of folds and grooves. The folds are called gyri or gyrus, singular. The grooves are called sulci. And then there's a big fissure that runs down the middle of this cerebrum that separates it into a right side and a left side. Take it apart. Right here. Big fissure that runs down the middle. Divides it into a right side and a left side. The gyri are the folds, the sulci are the grooves in between here. Then in your book, you can see a light blue area towards the back of the brain, like on the underside and the back. That is called the cerebellum. And then in the middle, you can see that tri-colored area. The top part in purple, it looks like, is the diencephalon. That holds some important areas like the thalamus and the hypothalamus and the pineal gland. And then below that is the brainstem, which is divided into 3 parts. The top part of the brainstem is actually called the midbrain. Then you have the light green area, it looks like, that's called the pons, which means bridge in Latin. And then you have the yellow part below that, which is the medulla oblongata. It's fun.
What part of your brain causes gigantism?
That's the result of excessive growth hormone that is released from the pituitary gland, the anterior pituitary gland.
My sister, she had like makes too much. She has a pituitary, and she's making too much.
She's making too much of the hormone.
I'm trying to.
She's making too much prolactin.
Prolactin. She's making too much prolactin.
That one I know for sure. Yeah. Yeah, this is true of any tumor in the pituitary gland, no matter where it's located. The one hormone that's always increases prolactin. That's why I said that one. It's a space-occupying lesion. Something that takes up space. Same place? Arachnoid cyst? Where? Quadra something cyst. Google it.
Not it, but I don't really understand.
You should understand it. So, what do these parts do? This is stuff that you should know. If you look at first the cerebrum on page 2, you'll notice what they did for you here. They color-coded the cerebrum for you, page 258 of the textbook. They've color-coded the cerebrum. And there are specific areas called lobes. And this is going to be true for both sides of the brain, because remember there's a right side and a left side. So the frontal lobe is going to be found where? If you had to guess. Under what bone? Under the frontal bones. And this area is going to include one of the newest parts of our brain, the prefrontal cortex. This area is responsible for things like determining the benefits and the consequences of your future actions.
Why is that the newest?
Right?
Did somebody just discover something?
Well, they didn't just discover it. However, for the longest time, people thought the brain was just one big area of mushy tissue. And even when they understood that it did things like thought and vital stuff, vital components like keeping you alive, they didn't really understand the concept of what we now call localization. In other words, different parts of the brain that specifically do things. Until the 1800s, when a guy, no, actually, let's see, Gage, Phineas? No, Phineas. What was his name? It sounds like Phineas was on it. I can't remember his name. It'll come to me though. Well, he's famous for this because he worked on the railroad in the development of the railroad, the construction of the railroad, and he was what's called a tamper. What they would do is they would drill a hole with rock, and then they would fill the holes with gunpowder and stick a fuse in it, and then they would put sand on top of that, pack it down so it was nice and tight. When they light the fuse, there'd be an explosion, and that would break apart the big giant rocks, make it a lot easier to cut through mountainsides, for instance. So his job going through tamping this stuff down at one point must have hit a. It is Phineas. He struck probably a rock or something that created a spark. There was an explosion. It blew the rod up through his head, went through his face, out through his head, took some of his brain with it, flew down the way, several hundred meters away or something. But the thing about this was he survived. He actually lived. But the one thing that people realized was that his personality changed. Where he had been a very easygoing, laid-back kind of a guy, now he was quick to get into fights and swear and do all these things. Indicating that because he lost that part of the brain, he didn't have the same ability to reason. The frontal lobe, part of the frontal lobe. We're getting there. The part of the prefrontal lobe. So when I say the frontal lobe helps to determine the benefits or the consequences of a person's actions, I don't just mean should they go to college or should they rob banks. That's involved in it. But I mean also day-to-day and moment-to-moment things. If, for instance, you're walking down the sidewalk and there's a big section, 3 foot by 3 foot of sidewalk that's missing and a 2-foot hole, as you're walking down the sidewalk and you see this, you look at it, you walk around this way, and you keep going. What you didn't realize is that as you're walking down and your brain sees this, your brain says, well, we could step down into it and then step out of it, but I might trip, that could get my shoes dirty, maybe not the best option. Your brain says, I could jump over it, but what if I don't make it? I have to expend a lot of energy and I might get injured. And then your brain says, I can walk around this way. That puts me closer to the road and puts me closer to traffic. And your brain says, or I can walk around this way. And I have to walk on this guy's grass, and he might not like that, but I'll still walk around this way. Your brain does all of this that quickly and determines the best route that fast. You don't even realize it happened. All you realize is you were walking down, you saw a hole, you stepped around it, and you kept walking. You didn't realize your brain considered all of those other options and picked the least dangerous one.
You realize that.
I'm sorry?
You realize it. And you know you're thinking, right?
Sometimes, yeah.
Okay.
Yeah, if there is a cliff and you got to get from this side to that side, and it's 7 feet away, or from a building top to building top, like in the movies, you might put a little more thought into it. But in something like this, where there's minimal risk, your brain goes through it that quickly. And when I say minimal risk, even if I look at this podium, there's a little cutout up here for where you put a pen or a marker. So when I take my pen or marker, I'm going to scan this real fast. My brain's going to go, oh, put the marker right there because it'll fit. And it'll keep it from rolling off. So my brain will come up with that answer before I have time to think about it. So yeah, if there's more risk involved, the brain takes more time. But with something like that, you don't even realize you do it. The way to remember this, that the frontal lobe helps to determine the benefits or consequences of future actions, is to think that the frontal lobe helps to determine what happens in front of you. Somebody's going to miss this on the test. And the rest of you are going to be like, how did you miss it? He said, in the front of you. That's how you remember it. And you'll say, I don't remember even hearing that. And that makes me sad. The frontal lobe helps to determine the benefits and consequences of future actions, what happens in front of you.
Got it.
Got it? Awesome. So, if you look on page 258, and you see that colored version of the cerebrum there, you'll also notice there's a parietal lobe. The parietal lobe contains the gustatory cortex. That's taste, which means you taste with this part of your brain up here. You don't taste with your tongue. You taste with your brain. It's happening up here. To get the signal to go to the brain to say, what is this? So technically, we could bypass that. If we cut the calvarium off here, the skull cap, and cut through the meninges, and I took a little electrical probe and I stuck it in just the right place, and don't ask me where that is because I have no idea, but if I stuck it in just the right place and gave a little electrical zap, the patient would say, I taste chocolate.
So taste buds really not taste buds?
Taste buds are taste switches. It's just a switch. And it either gets switched on or it gets switched off.
Oh, so you can so that it's allowing you to.
I could say to you that light in this classroom comes from this right here. This is what makes light. Because look, there's no light. And you would say, no, you idiot. The light bulbs make the light. The switch just sends an electrical signal through the light bulbs. And that's where the light comes from. Oh, yeah, okay, I guess you're right. So the brain is just collecting information from the switches. The switches are on the tongue, and they're either getting switched on or they're not getting switched on. Those are the options. And then it takes that information and sends it to the brain and says, now you interpret this. Lobster. Well, remember, we interpret all the world differently. We all do. That's why I'm like, oh, I really like something, and somebody else is like, oh, I hate that. There are people who don't like chocolate. That's a genetic defect. We should get rid of that. I'm just kidding. I'm just joking. Because as long as they're not eating it, more for me. There's also, in the parietal lobe, we have areas that pick up sensation like pain or vibration or cold. Near the parietal lobe, but just more into the frontal lobe a bit, there is a speech center. This is more in the frontal lobe, but it's close to the parietal lobe, which interprets speech. So it makes you understand what I'm saying right now.
No, because I don't know real quick. I put it sends signal. I mean, the parietal lobe is for taste, but that's for just saying too.
No, that's more for the frontal lobe, but it's close to the parietal lobe. So it's like near the border of the parietal lobe, but it's still frontal lobe. What's the next one on there? Temporal lobe. Hearing. This is where hearing takes place. That doesn't make a difference. Doesn't make a difference what part of the brain they get hit in. They get hit in any part of the brain, they can die. Don't hit anybody in the brain. We're in health care. We care for people's health. Exactly. The temporal lobe also has olfactory center. That's where we smell. Smell is interpreted here. And you'll notice the temporal lobe is named after what bone? There you go. Under the temporal lobe. So when I say it has the hearing that takes place here in the temporal lobe, that's different from speech interpretation. So when I'm speaking to you, and these sound waves are making it into your brain, in your temporal lobe's interpreting this as human speech. Not what I'm saying, just human speech. Not until it gets to the just past the parietal and the frontal lobe where you're actually understanding the words from my face. Sort of, yeah. And then the last one there, occipital lobe, which is named after occipital bone. And the thing that happens in the occipital lobe, vision. Vision takes place back here. So I tell people to remember this, just remember it's like having eyes in the back of your head. Because you've heard this before, right? You've heard this saying? So if you think of it that way, vision takes place in the occipital lobe, back here. The information is collected from the eyes, and it goes down the optic nerve, which is cranial nerve 2. And then it crosses over, but only half. So half from this eye and half from this eye cross over and go to the opposite sides of the occipital lobe where it's interpreted, and the other two stay on the same side and go to the back, and it's all interpreted into one big picture. Yes? That would be something he'd have to talk to with a neurologist and a psychiatrist.
I don't think he realized they told him he had the TBI.
He has a what? You hear this? A TBI. You'll hear this a lot. Stands for traumatic brain injury. Problem with that is, since we don't know how the brain works completely, we know this part of it, and we know like what areas are responsible for certain things, but we don't know how to fix something like that. You know, there was a time when behavior was modified using medications. That time is today. We call it Ritalin. If you go back to the 1940s, 1950s even, there was another way, along with medication, that they can try and control people's behavior. Frontal lobotomy. They go in with an ice pick. Well, what looks like an ice pick. First it was a leucotome. It was an actual knife that looked like a butter knife. But then they, what was his name? Robert, the lobotomist. Going through with this ice pick looking thing, and they would just destroy part of the frontal lobe of the brain. It is. They don't do that anymore. Yes.
The occipital lobe, when people are blind, is that part like
That's a good question because This question comes up all the time. Remember, vision finishes here, but it starts here, right? So the information has to come in through the eyes. So if you put on a blindfold, you can't see. But it's not because there's anything wrong with that part of your brain. You're just not getting any information in. But then the information has to go from here back along those nerves back to here. So what if there's an interruption in the nerve back to there? It won't get back there. Or part of it gets back there. So that could change the vision. So when somebody has a vision problem, we have to determine where that vision problem is originating. Here, or behind the eye, behind the lens, in the retina, in the nerves, or back here. Color blindness is a problem with some of the switches, the cells in the retina. There's a deficiency of cones, those types of cells. So they won't see that particular color. It's not, people think that color blindness only happens in men. It doesn't. It can happen in women. It's just much, much, much less common in women, and it's much less severe in women. So it can happen. The cerebellum, that part that's sort of not colored on page 258, that's at the bottom, it's not labeled on that one. But you can see it on page 256 or on page 253, the light blue. The cerebellum plays a big role in balance. And balance is incredibly difficult, especially when we put in variables. In other words, walking up steps is incredibly complicated. Because imagine what you have to do to walk up steps. You have to shift your weight in your body to one side, pick this leg up, then move that leg forward, then shift the weight diagonally this way while taking the weight off of this leg while flexing the muscles and pulling the muscles up, and then doing the same to the other side. There's a lot of intricate little movements that have to happen at the right time in order to walk up steps. It's pretty complicated, but it requires that balance. The cerebellum helps out, is the main thing in the brain that controls three-dimensional space with our regard to how we are in the environment. If you're upside down, if you're tilted to one side. Now, I know a lot of people say, I thought that had something to do with the inner ear. Because if you have inner ear problems, you lose your balance. Well, that's true, because there's a thing called the labyrinth that's in the inner ear. And in that part of the labyrinth, there are special sensors that send signals to that part of the brain. So if there's a problem with that, it's just like what I said with vision. If you cover up your eyes, you're blind. So if you mess with those little sensors in that part of the ear, yes, it's going to send confused signals to the pons and then to the cerebellum as well. The pons has a direct connection to the cerebellum in that way. Let's see, where should we go next with that then? How much time have I got? Okay, plenty of time. I mean, let's skip to okay, if you look at this page with the notes, this is like the second page of second page of chapter 12. Second page of chapter 12. At the top of that page, the Meninges, this is like the bold printed second word down, the Meninges, you don't have this page?
Okay. You want a wrong packet.
The Meninges Who else doesn't have a packet? Anyone? The meninges are protective layers around the brain and spinal cord, going from the outside in. The thickest, most durable part is called the dura mater. The layer underneath is called the arachnoid mater. And it is underneath the arachnoid mater that there is what we call a subarachnoid space. This is the area where cerebrospinal fluid circulates. And then the third layer is the pia mater. It's the thinnest layer that is shrink wrapped around the brain. So it's important that you know this because everyone in here has heard of meningitis, but you've probably not heard of meninges. Meninges are the layers that are around the brain and around the spinal cord. If there is inflammation because of injury or infection, we call that meningitis. Now, what follows inflammation? Swelling. If there is inflammation around the brain, there's going to be followed by swelling around the brain. That's going to put pressure on what? The skull. The skull's solid. It's not going to move. It'll push onto the brain. Yeah, the skull won't expand unless it's a baby. The skull won't expand. It's going to put pressure inward onto the brain. That's dangerous. That's why we are concerned about meningitis.
I don't understand. What do you mean it's going to put pressure inward on the brain? Isn't that the brain itis thing? It's inflaming. It's putting pressure on the skull. I know it doesn't expand.
Yeah.
I know it doesn't expand, but the brain is expanding.
No, because we have the layers on top of the brain like this.
Right.
So if this becomes inflamed, then that's going to be followed by water. Water always follows inflammation. Well, this area is going to fill up with water. Whether the water is on the outside of this or underneath this, it's still on top of the brain.
Oh, okay. I see what
The
you're
skull itself is out here. So as there's more and more fluid put in there, the skull's not going to expand, but the brain will get squished this way. The only time the brain's going to expand is if it's a baby's brain. That happens when they have too much cerebrospinal fluid. That is something called hydrocephalus. And what will happen is, in the ventricles right in here, there's going to be too much fluid produced. The reason this is bad is because it's going to separate right here. So there's going to be a separation of brain right here. So part of the brain is going to be explaining this way, part of it is going to get smashed downward. Bad on so many levels. And their head can grow. Because remember, those sutures haven't fused together yet. They do, it stays like that. This is why when you take your kid to the pediatrician's office, they do a head circumference. We want to make sure that their head is within the right numbers that it should be, the right range that it should be. Because if it's indicating abnormal growth, we better figure out why. So it's important that you know what the meninges are because you're going to hear about meningitis. These are the layers that are around the brain and the spinal cord. However, there's an additional space around the spinal cord. That is called the epidural space. This is where an anesthetic agent is injected to numb incoming messages. It numbs mainly incoming messages. That's why she can still wiggle her toes, but not feel the childbirth. It makes childbirth simple, and it works 100% of the...
That's it. I got paralyzed on one side.
It,
Yeah. That's what it's for.
So I'm wrong with that? Of course I'm wrong with that. First of all, it's just a good option. It doesn't work perfectly for everybody all the time. But remember, nothing does. If I have a headache, I take 2 Advil. Works perfectly. If she has a headache, she has to take 4. If he has a headache, he has to take 6. If she has a headache, Advil doesn't touch it, she has to do something else. That doesn't mean Advil doesn't work. It just means it works differently for everybody. And the thing is, everyone in here already knows that. Everybody knows that Advil works for me, Advil doesn't work for me, I have to take Tylenol, so I gotta take something else, I gotta take double the dose. Everybody in here already knows that. So why are you surprised when somebody gets an anesthetic agent injected into them and they say it worked perfectly, and then I got one, it's like it didn't work at all? Well, of course not. It's not going to work perfectly in everyone.
They asked you to film, I guess it's a video something, and then like me, I got 2 shots. I didn't want to do nothing. So then she did you get 2? Yeah, I don't know then.
They put it in your nerve?
Yeah.
It was like if you start tasting any type of medicine or hear ringing in your ears, it was input wrong. And I had
that doesn't mean it was put in a nerve.
They said it was put in my nerve. And then I got like back spasms and stuff now.
This is a very, first of all, it's a very common thing that people complain of back pain or back spasms after getting an epidural, and most of the time it has nothing to do with the epidural. It's the fact that you had a baby that was out to here and you're carrying this baby around for a long period of time. You know that when you lift something heavy, you don't lift with your back, you lift with your knees. Everybody knows this. You don't always follow that rule, but everybody knows this. However, when you're carrying a baby out to here, do you realize what happens to the spinal cord? You got to change your center of gravity. So these little tiny muscles that are not meant for holding things up are now holding things up. And they get strained and they get injured, and the nerves to them get injured, and they're never the same. And people say, oh, that's right where I got the epidural. Coincidentally, that's also where these little muscles are. I'm not saying that's what happened. I'm saying that very often people complain of that happening, and it had nothing to do with the epidural.
And then you kind of think this is like the needle is big.
Yeah, and when they say bend over, do not move, or you'll be paralyzed, that's because there's a small space. This needle has to go into this space and not too far. If it goes too far, it could hit the spinal cord. If it hits the spinal cord, then we're talking about this right here, which means paralyzed. Now, the reality is, will it really slice through all this, or will it do something like this and sort of separate a little bit of them? More likely separate. There might be a little bit that gets cut, but it's more likely to separate as it goes through. So is it going to do this, or is it going to do this? Probably more like this. Can it do this? Yes. Is that likely? No. But do we want this to happen? No. So what do we say? Do not move or you'll be paralyzed. Because then people go.
When I asked, the doctor was like, what do you think?
Which is perfectly acceptable. The risk is very, 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 very small, but it is a risk. We're not done yet. We got some. Okay, that's all. Hey, look at this. Oh, there's some more stuff. Wow, look at over here. The spinal cord. Where's the spinal cord? Structure of the spinal cord. It's on the very next page. So if you take this page right here and you turn it over, right at the top, not in any way highlighted. Structure of the spinal cord. Spinal cord lies within the spinal cavity. That is the space between the vertebrae. Within the vertebrae. And you can see from this really nice model we have here. You can see this bone right here. I forget the name of this bone. Oh, that's right, the occipital bone. You know that's the occipital bone because there's a big hole right there. The spinal cord is meeting the brainstem in. So that's got to be the occipital bone, which means this right here has got to be the brainstem. Here's the pons, here's the midbrain, just below that, the medulla oblongata. You can see here that the spinal cord is completely surrounded by bone. And as the spinal cord goes down through here, branches come off of the spinal cord that are sending signals out and also collecting incoming signals. Completely surrounded by bone. Why? Protection. We want to protect that because that's got an important job to do. It goes all the way down to about the level of L2. I don't have that on there, but that's okay. And then it splits off into what looks like horse's tail called the cauda equina. Let's see. Moving down on that page, you see the brain, one of the largest organs of the adult human, consists of roughly 100 billion neurons, 900 billion glia. The diencephalon includes the pineal gland. The pineal gland is what is responsible for our circadian rhythm. That's our wake-sleep cycle. That's why, as the days get shorter, there's less sunlight, there's more release of a substance called melatonin, which makes you tired. You're going to notice in the next month and a half, I think, when we hit spring and suddenly the days get really long, you're going to have more energy. You're going to want to be out doing more stuff. You're going to be awake longer. In the wintertime, it's like, I just want to nap. I just want to eat pasta and go to sleep. Amen. Okay, good. At the bottom of the page, consciousness, and even in parentheses, know this, capital letters. Consciousness, state of awareness of oneself, one's environment, and other humans around us. Right down at the bottom of that page, consciousness. You see that? Know this. Good. Aphasia, language defects. There's different types of aphasia. Some aphasias, a person knows what they want to say, but it comes out. Other types of aphasia, they can talk perfectly fine. Hi, how you doing? Okay, how you doing? And then somebody talks back to them, and instead of hearing clear speech, they hear. Anybody? Oh, thanks.
Well, how can they talk to if they can't hear if they're not interpreting?
So would you see someone with
I didn't say that.
language?
But that's what I'm saying. Like,
Yeah, I'm talking about like a surgery.
Oh, yeah.
oh, that's what I'm saying. So it's initially like you find.
Just like I'm fine right now. Next Tuesday, I'm going to do the entire lecture going. That'll be interesting.
So it's like four, it's probably like.
It's usually the result of some sort of brain.
Right, that's what they.
Yeah, because it's difficult to know how to make a word sound like a word if you don't know what it sounds like. Yes. Okay, can I borrow your textbook real fast, please? Thank you. Please write this down. This is due next week. Please write this down. This is due next week. Please write this down. This is due next week. We're going to go back a little bit. On page, write this down, on page 134, under the review questions, 134, page 134, under review questions, questions 1, 2, and 3. You can record this if you'd like. Questions 1, 2, and 3. Textbook, page 134, review questions 1, 2, and 3. Then page 150, page 150, review questions 1, 2, and 3. And then page 184, review questions 1, 2, 3, 4. So that's 10 questions total, right?
For 150, questions, all of them?
184.
No, for 150, the review questions, do all of them?
1, 2, and 3.
Okay.
Page 184, review questions 1, 2, 3, and 4. This is homework due next week.
Are you actually collecting?
I'm actually collecting it, so please make it legible. If you're printing it out, if you're typing it up, that's good. It should be, but if it's not, that's okay. Now, you've got a couple of things coming up. Yeah, get the other pages, the other chapter review questions. There's 10 total. You have a nutrition exam coming up, right? I'm going to turn this off now if that's okay.